Now we get to look at two tests in orthopedics. So these two tests is more of like we're trying to emphasize on, their uses, so to say. So look at the Thomas test. Then also look at the Trendelenburg test. The Thomas test and the Trendelenburg test. So for these two tests, this is a Thomas test. Okay. So what do you have here? Both of them, they're actually they are maneuvers. So they're actually examining the musculoskeletal system. So but they access different aspects of the hip, So the Thomas test is basically trying to dictate hip flexion contracture, where there's tightness of the iliopsoas, So here you can see that his leg is way above this, but here he's not able to move his leg above. So that means there's a contracture. Okay, so let's quickly keep moving. So methods is the patient lies facing up, that's supine, on an examination table. The examiner flexes one hip, bringing the knee towards the chest. So the opposite leg should remain flat. Do you understand? So if the leg lifts off the table or the lumbar spine aches, it indicates that there's tightness. That simply means see, this leg is lying flat on the table, but because of contracture, this leg had to actually rise away from the table. That's what we call a Thomas test. Okay, contracture, so you have to go all in, All right. So Trendelenburg test now, purpose is to access hip abductor strength, particularly the gluteus medius. Okay, so methods, you say that the patient stands on one leg. So you're trying to look at if the right side of the hip and the left side of the hip, if it is same height. Okay, so the examiner will observe the pelvis. So if the pelvis drops on one side, shows you that there's weak hip abductors. So clinical use is mainly used in dictating if there's superior gluteal nerve injury or hip dysplasias, or probably after a hip surgery, you use this to access.